Alright, hi guys. So let's start the recall of FMG, and right now we are going to discuss June 2022. Now this recall that we are going to discuss is one of the most authentic recall, and I would say that we have put a lot of time and effort from collecting the data from the students usually, and it has taken a lot of time, and definitely you guys are going to enjoy this FMG June 2022 recall. So let us see the very first question that was asked. A 70-year-old Parkinson's disease patient suffer from constipation after taking anti-Parkinsonian treatment. Which of the following drug may be responsible for the above symptom? Okay, constipation after taking anti-Parkinsonian drug. So anti-Parkinsonian drug, Parkinson disease में there is in Parkinson disease there is a degeneration of dopaminergic neuron. ठीक है, degeneration of dopaminergic neuron. Because of this, the outcome will be something like this: that dopamine level is much lesser as compared to acetylcholine. So normally there is a balance between the both, but because of the degeneration, there is level of dopamine is lesser compared to acetylcholine. This is how we see here. Acetylcholine is high. So for the management of the Parkinson disease, what we do, we give a dopamine agonist. And a dopamine agonist we can give levodopa. They will have different kind of side effect. Or you try to bring the level of dopamine up. Dopamine कम है, dopamine के level को बढ़ा दो, or you try to bring the acetylcholine down, or you give centrally acting anticholinergic. Centrally acting anticholinergic. This centrally acting anticholinergic that I am talking here will be having drugs like your benzhexol, benztropine, trihexyphenidyl, है ना, benzhexol, benztropine, trihexyphenidyl, procyclidine. So these are the centrally acting anticholinergic, and if they are anticholinergic, they will never leave their nature. Their nature, anticholinergic drug is to cause blurring of vision. Anticholinergic है तो they can cause dryness, they can cause decrease in the secretion. Anticholinergic है so they can also cause constipation, right? Constipation, they can also lead to urine retention. So these are the important side effect of this anticholinergic drug. Which anticholinergic? Centrally acting anticholinergic drug. They are associated with this kind of side effect. I hope it is making sense to all of you guys. And levodopa will have other side effects, like they can cause fall in the blood pressure, and they can even lead to in high doses they can even lead to other problems like increase in the blood pressure, and they will have problems like in the eyes, and among the given choices, which drug will be responsible for the constipation? That is going to be your benztropine. This is the centrally acting anticholinergic drug. Levodopa is definitely the drug of choice for Parkinson's disease in this patient, 70-year-old patient hai na. Pramipexole ropinirole. What is pramipexole ropinirole? है ना, pramipexole ropinirole. It is also one of the drug that is dopamine receptor agonist, non-ergot dopamine receptor agonist. Metoclopramide is a D2 blocker. It's a D2 blocker. It will precipitate Parkinson's disease. Already dopamine level is high in this one. So correct answer for this one is benztropine, because they are the centrally acting anticholinergic drug, and these are associated with side effects like blurring of vision, secretion reduction, dryness of mouth, urine retention, constipation and all. Drug combination preferred for medical termination of pregnancy, and I think this question has been asked a couple of times as well. So we always try to use misoprostol, one of the prostaglandin analog. In addition to this, anti-progesterone like mifepristone, which is also given the name as the RU486. Misoprostol, mifepristone, these are the one. Lubiprostone, it's one of the drug that is utilized for improving intestine secretion level, to improvise the intestine secretion level. Lubiprostone, right? L-prostadil, it's also one of the PGE1 analog. L-prostadil is a PGE1 analog that is mainly given L-prostadil for erectile dysfunction. So which two combination? Mifepristone and misoprostol. So again, same information has been taken from the book. The preferred is mifepristone, misoprostol. Mifepristone is anti-progestin that I told you already, in combination with misoprostol and other PG like dinoprostone, a PGE2 analog that can also be utilized. All right, when mifepristone is used to produce medical abortion, that is MTP, first trimester pregnancy, it is given 48 hours after the anti-progestin. So this is the, how are you going to give the dosing and all other information has been given. The dosage of mifepristone 200 milligram orally. This is important because in 2019 they have asked the dosage as well. So mifepristone 200 milligram orally, followed by 1 to 3 days later misoprostol 400 microgram, है ना, 400 microgram, 4 tablets of 200 microgram vaginally, है ना, 400 microgram vaginally you can give, and mifepristone orally you will be giving, right? So this is the preferred one. This is the preferred regimen that we have. In a patient with proliferative diabetic retinopathy, which of the following monoclonal antibody is used? So for the proliferative diabetic retinopathy, we always use VEGF inhibitor, vascular endothelial growth factor inhibitor. So earlier we knew two important one. One is known as your ranibizumab, and other there is one more, bevacizumab, है ना. So we used to remember by the mnemonic like bevafarani, है ना, bevacizumab, ranibizumab, or like our ophthalmology sir, no, Shashwat sir says, and Bewakoof Rani. So you can remember that way as well. So for the proliferative diabetic retinopathy, you will be using monoclonal antibody, that is VEGF inhibitor. But there are new VEGF inhibitor as well, है ना. So again, in the among the given choices, bevacizumab. Belimumab is a monoclonal antibody that inhibit the B cell activation. It can be utilized in many conditions, including SLE. SLE may you can use belimumab. Infliximab is one of the TNF alpha inhibitor that can be utilized mainly in rheumatoid arthritis, inflammatory bowel diseases. Rituximab is one of the anti-CD20 monoclonal antibody. Don't forget, Ritu is the young girl, right? Ritu's age group is 20. So if you watch any of the monoclonal antibody wala chapter, rituximab is always discussed, and used to say Ritu बहुत young है, Ritu is very young, her age group is just 20, है ना, rituximab. Okay, now what are the other monoclonal antibodies? See, VEGF inhibitor में beofarani, beokufrani, bevacizumab, ranibizumab, brulocizumab, they all are used for the same condition, है ना, they all are used for the your proliferative diabetic retinopathy, है ना, macular degeneration, age related macular degeneration, है ना, ये इनका यूज होता है ना, wet kind of age related macular degeneration, proliferative diabetic retinopathy, we can use this, है ना. So beofarani brought a pig, just a way to remember, right? Or Bewakoof, that sounds much better. Bewakoof Rani brought a pig. So Bewakoof will be bevacizumab, ranibizumab. Brought will be brulocizumab, again a VEGF inhibitor. These are the newer one, aflibercept and pegaptanib. They are not monoclonal antibody, but definitely they are also having VEGF inhibitor. Pegaptanib again is a tyrosine kinase inhibitor. Aflibercept, pegaptanib. So Beofarani brought a pig. All right, next. Which of the following agent is used in rheumatoid arthritis act by opioid and non-opioid receptor? Opioid and non-opioid receptor के लिए कौन सा होगा? So the correct answer is tramadol. Tramadol is actually a mu receptor agonist with SNARI. SNARI is serotonin noradrenaline reuptake inhibitor. SNARI, serotonin noradrenaline reuptake inhibitor. They are going to increase the level of serotonin, and they can also increase the level of noradrenaline. Okay, not the methotrexate, which is a dihydrofolate reductase inhibitor, or etoricoxib, which is a COX-2 inhibitor. Paracetamol is a COX-3 inhibitor, है ना. Paracetamol is a COX-3 inhibitor. Methotrexate is one of the dihydrofolate reductase inhibitor. So rheumatoid arthritis, can we use etoricoxib? Yes. Can we use methotrexate? Yes. But examiner is asking which is used in rheumatoid arthritis act by opioid and non-opioid. So opioid because it's a mu receptor agonist, non-opioid because they are inhibiting the reuptake of serotonin noradrenaline. So they can increase the serotonin and noradrenaline. So mu receptor agonist with SNARI, serotonin noradrenaline reuptake inhibitor. Then we have one more. Next time you can get this as well in your examination, that is tapentadol. It is actually a mu receptor agonist with NARI. Mu receptor agonist with NARI, that is noradrenaline reuptake inhibitor. Mu receptor agonist with NARI, है ना? So they will be increasing the level of noradrenaline. All right. Next, all of the following are side effect of ritodrine except. Now ritodrine, first and foremost, you have to remember it's a beta 2 agonist. They are all purely pharma question, remember, and it has been asked in this June 2022. So around 28 questions where there are pharma mein, there are always 25, 28 questions that are asked in your examination. So you can not simply just take it for granted. You'll have to make sure that your basics are strong. And if you go through the class notes or the usual regular rapid revision notes that we have covered here, most of the question you will be able to solve from here. Now, ritodrine is one of the beta 2 agonists. Please remember, if they are beta 2 agonist, they will be acting at the uterus, so they will be causing relaxation of the uterus. So because they are causing relaxation of the uterus, they are utilized to slow down the premature labor. So as a tocolytic we can utilize. Because of the beta 2 activity at the skeletal muscle, will be causing tremor. Remember, beta 2 activity at the liver will be mainly causing what? They will be causing gluconeogenesis. And glycogenolysis. Because of the gluconeogenesis and glycogenolysis, they are going to increase the glucose level. They can cause hyperglycemia. They can increase the glucose level as well. Remember, because they are having beta 2 and beta 2 is also present on the blood vessel, they can also decrease the blood vessel tone, and there are episode of pulmonary edema as well that can be caused by this drug. Now look at this. Examiner is asking all of the following are side effect except. Let's read from down to up. Tremor. Can it cause tremor? Yes. What about hypotension? Because they are beta 2 agonists at the blood vessel, they will be causing vasodilatation. Will it cause fall in the blood pressure? Possible. What about tachycardia? Will it cause tachycardia? You see, any fall in the blood pressure, can it induce reflex tachycardia? Not only this, you also understand that beta 2 in the high dosage, they will also be acting on the beta receptor of the heart. So other beta 2 agonists like salbutamol, terbutaline, right? Other beta 2 agonists that we have, they also stimulate the beta 2 and they can also increase the heart rate. Because there are some beta 2 also present at the heart, not much, but this beta 2 agonists at the heart, they behave as beta 1. So at the high doses, they will also stimulate the beta 1 receptor of the heart. They can also increase the heart rate. What about hypoglycemia? Will it cause hypoglycemia? You see, because the beta 2 of the liver is stimulated, there is gluconeogenesis, glycogenolysis, they are going to cause hyperglycemia. So all of the following are side effects except hypoglycemia will not be seen. There will be hyperglycemia. Okay. So this was a very conceptual kind of question. To minimize the HP excess suppression, what is the correct method of administration of steroid? See, correct method of administration of steroid, whenever we do continuous dosing, there will be suppression. So textbook has suggested 3 important steps. Step number 1, to reduce the HP excess suppression. Step number 1 that has been suggested, intermediate action preparation. Don't give the long action preparation, right? Not the long acting. So long acting preparation like your betamethasone or dexamethasone, they are avoided, not the longer acting. So one step is being suggested, that is intermediate dosing preparation like prednisolone should be given. Second option is that alternate day dosing rather than giving a continuous dosing. Alternate day dosing with the same steroid. And other one is that pulse therapy with the higher glucocorticoid doses. If you are going to give higher doses, give the, we call it as a pulse therapy. So either intermediate dosing, alternate dosing, intermediate, alternate, or pulse therapy. Now let's read the option. Give at night just before the bedtime. Give on alternate days. Replace with beta. Longer acting हमको नहीं देना, याद रखना. Intermediate acting we have to give. Divide into 3 doses. They are telling give pulse therapy. Don't divide. Give pulse therapy if you want to give. So give on alternate dose is the only option that is matching our the explanation that we have. So textbook recommend, or even the guideline also recommend 3 important ways to minimize the HP excess suppression. Intermediate dosing. So there is no intermediate dosing preparation. Intermediate action preparation, they are telling longer acting preparation, like C is a longer acting, betamethasone is a longer acting. Alternate day dosing, so again B is alternate dose, so that is the correct answer here. And A is give at night just before the bedtime. No, right? So they are telling intermediate dosing should be given in the morning. Intermediate dosing, in the morning. They are given in the morning, not in the night before, right? So this will be everything which were asked in our June 2022. So around 25 to 28 questions were asked, and you can quickly see that HP axis is one of the topic, then retorted side effect is one of the topic, tramadol tapentadol is one of the topic, VEGF inhibitor ranibizumab bevacizumab beofa rani brought a pig, है ना. Then MTP, medical termination of pregnancy, Parkinsonium, which drug will be causing constipation, so central acting anticholinergic drug, organophosphate carbamate, and pralidoxime will not be effective in carbamate poisoning. Remember, in a mild kind of diarrhea we can use opioid like loperamide. Chemo induced diarrhea also loperamide. LD50, that is a dose that can kill 50% of the experimental animal. Diabetic ketoacidosis, how will you treat? Insulin plus IV fluid. We always say ACE inhibitor, they have mortality related benefit. Neohistamine atropine, after the snake bite, after the antivenom, this is the preferred. And I have also explained why are we adding atropine, the rationale behind adding atropine. Morphine toxicity will present to you with the pinpoint pupil, decreasing the heart rate. Remember, others are sympathomimetic here. Then we are also having hypertensive emergency. Which drug will be less effective? IV mannitol will be less effective here. Amphotericin B for the mucormycosis. Next, it is tamoxifen, which side effect, that is endometrial hyperplasia. Next is Raynaud's syndrome. We are going to use calcium channel blocker, and they have a side effect of, which drug, what is the mechanism of action of aspirin in thrombosis? So again, they are the COX-1 inhibitor. Other explanation has been given here already. Clopidogrel is a P2Y12 inhibitor, and they are given along with aspirin. We call it as a dual antiplatelet therapy. Lithium as a drug of choice in mania, always a hot topic. Cyclophosphamide, ifosfamide, in fact, anti-cancer drug important side effect, always a hot topic. Azithromycin for Legionnaires disease or for atypical infection. Warfarin will not be preferred in the first trimester of pregnancy. That is one question. Hyperthyroidism in pregnancy. Propylthiouracil. Then rasburicase is fastest to decrease the level of uric acid in tumor lysis syndrome. Leukotriene antagonists, they will not be effective in the acute bronchial asthma attack. Varenicline in smoking dependence. After the nicotine replacement therapy, we can utilize them. Then if there is a depressed patient, we are going to use bupropion. Patient with glaucoma also suffering from bronchial asthma. So which drug should be avoided? Timolol can precipitate the bronchial asthma, right? So this will be everything for this one. We have quickly revised this once again. Thank you very much to all of you. I'll see you in the next class.